commentary on various subject matters with a laser-like focus on the truth. My name is Ray Tampa. I'm the host of the Ray Tampa podcast. We have in our studio Mr. Russell K. Toe, a retired teacher with more than 42 years of experience in the Pinellas County schools, and Mr. Jamie Wilson III, a healthcare provider with more than 30 years of experience in the field of physical therapy. My co-host, my dynamic co-host. We have in our studio today, or I'll say it this way, we are ever so grateful to have Ms. Janis Starling join us in the studio today. Janis is here to share her immense knowledge about so much related to chronic kidney disease. Chronic kidney disease. Janis, welcome to the Ray Tampa podcast.
I am excited to be here. Thank you so much for inviting me.
By all means, by all means. Janis, please share with our audience a little information about yourself, such as where were you born, raised, and educated?
Yes, thank you. My name is Janis Starling, and I am the fifth eldest of 6 children born here in St. Petersburg, Florida. My father's name was Jimmy Lee Starling, and my mother, Viola Starling. And my family owned and operated Starling School and Daycare Center since 1974. And I remember running through the walls while the building was being built. More than 30 years ago, I've been proud to carry on our family legacy in education and childcare. In 1993, I earned my BA in early childhood and elementary education from Nova University. And later, I went to the University of Phoenix to receive my MBA degree. My faith has always been an essential part of my journey. So I hold right now a 4-year theology degree from Life Christian University, which the main campus, the Pinellas campus, is at Word of Life Fellowship Church. And I also have a Christian counseling degree.
Awesome, awesome, awesome.
Yes.
Okay, I knew a lot about you, but I didn't know you were in theology at this point.
Oh, I love God's word.
Congratulations.
Yes.
Congratulations.
Thank you.
Janis, it's our understanding. It's our understanding that you're on the registry for receiving a kidney. Is this true?
Yes, that is true. That is very true.
Okay, and how long have you been on the registry?
Well, let me tell you a little bit more about my journey from the beginning, and that's going to kind of sum it up. My life took a difficult turn in the year 2000 when I was diagnosed with end-stage renal disease. I didn't know what end-stage renal disease was, which is, they call it ESRD. It was called, they say I had hypertension and I had to do dialysis. My first reaction was I wanted to kill myself. And the doctors told me, you can't do that, young lady. And because he saw me reading the Bible, I was like, yeah, you're right. I can't do that. I just can't do that. That's not biblical and that's not sound. But afterwards, I said, I got to learn everything I can about kidney disease and in ESRD. So I remember that was back in 2000, actually 1999, 2000. They had to bring in a TV that had VHS in the hospital so that I could watch the VSS learning educational. So that's how long ago it been. You think about TV now. So they didn't even have VHS. That's video when you put the video in. I know some of our listeners might not remember that. So that's how I started educating myself. And I knew that I didn't know. So if I didn't know, I knew it had to be other people who didn't know.
Right.
So I took on myself to learn as much as I could. And during that 14 years, I did peritoneal dialysis. That's when you do dialysis in your stomach. They put a catheter in your stomach. And I started doing that. And from the educational, I said, well, if I got to do peritoneal dialysis, go ahead and do my fistula That's when they take your vein and your artery and connect it together. So during that time, I said that can be healing while I'm doing my peritoneal dialysis. So I did peritoneal dialysis for 3 years. I did in-center dialysis. They call that in-center hemodialysis, where you go in the center, they cannulate your arms, or they put a catheter in your chest. And I had to have catheter in my chest. And I did that for 4 years. My sister Carolyn read an article, she used to read it in the family, about this little machine that these two people carry as they camp. And so I called every person in that article to find out about home hemodialysis because I wanted to return to home hemo. The thing about peritoneal dialysis, I gained almost 100 pounds because the fluid is sugar-based. So every night that I was doing the peritoneal dialysis, it was adding calories, and I was getting it. So it was like I was eating a Snicker bar every night without enjoying it. So, so I gained weight. I got up to almost 298 pounds doing peritoneal dialysis.
Wow.
So then I did in center. My sister told me about home hemo. So the first home hemo was in Orlando, the center. So I told my doctor I was going to go to Orlando. Me and my husband was going to go and find out about this home hemodialysis. He said, "Hold on, Janis, give me a minute. If we can get it here," that's when DaVita was going to be changed. Gambro was going to be taken over by DaVita. So now it's a DaVita center, which I was doing DaVita. So I convinced him and a nurse to start home hemodialysis. So I did home hemodialysis for 7 years, had a kidney transplant at December the 13th, 2013. 10 and a half years I had my kidney transplant. And now in 2004, my kidney transplant failed, which was 10 and a half years, which they give for a deceased donor when you sign up for the organ donor. We're going to talk about that. And a young man that was 33 years old, I still have his kidney. It's still working, but it's not working all the way. So I had to go back on home hemodialysis. So right now I do home hemodialysis by myself at home. I set my machine up, self-cannulate my arms. I have a fistula right here, and I put my needles in my arms right here, 15 gauge needles. Yeah.
Wow.
Yeah. I know that's a lot.
That's a lot.
You got your
You describe certain dialysis
Yes.
that I never heard of. I've always just heard of kidney dialysis, but you got into specific types
Yes.
of dialysis.
Yes.
And we may come back to those types later on,
Okay.
because I did mention that you have an immense knowledge about kidney disease. So we got a lot to talk about.
Yes.
Now, how are people selected to be put on the registry?
That is a very stringent task that most people with kidney disease, they just say, "Oh, I want to get on the kidney transplant list. I want to get," and I thought that I was on the kidney transplant list because my doctor said, "You'll be a great candidate," because I was 38 years old when I first, 36, 37, somewhere in there. So when I was first diagnosed with kidney, but I remember at 18, when I went to my primary care doctor, he said, "You have high blood pressure." And I remember back at 18 being on high blood pressure medicine.
18.
So at 18 years old. So I got some more to tell you about that, because I found out that I have a family genetic disorder that's called APOL1. That's a gene that if you're from South Africa, from the Western South African tribe, people from that, because I said I got high blood pressure and I don't have diabetes, I don't have anything else. Most people with just hypertension, which is called FSGS, that's a scarring of the kidney. All right. And with the scarring of the kidneys, that's what caused the kidneys to disintegrate and to die. My kidneys now are about the size, one is about the size of a dime, my native kidneys, and one is about the size of maybe a nickel.
Before you move further, I want to
Yes.
say something for the sake of people understanding the comparative analysis here, generally the size of a kidney is
The size
the
of your
fist.
fist.
The
Yes, the
fist.
size of your fist.
So you're saying
you're
that
saying that,
your
yeah,
kidneys,
my native kidneys,
yeah,
they're about the size of a dime
wow.
because of the scarring. You figure it's something, it's just like a burn, you know, the tissue is just scarring and scarring and scarring, and it just
Atrophies.
right. And it just, what's the word?
Yeah.
You said?
Atrophies.
Atrophies, and it just shrinks, pretty much shrinks away. Yes.
Okay.
So to get on the registry, let's get back to that part. To get on the registry, a patient has to have compliance in the dialysis center. You can't say, I'm ready to leave. I got to get off. I'm tired of this machine. So that's one thing. You got to be compliant. You have to take your medicine. You have to see the doctors. You got to go to all your appointments. If one doctor says something negative about you, that can cause you not to go on the transplant list. Okay. So that's one thing. You have to be compliant. The next thing, you have to follow your diet. You have to follow, you can't have high phosphorus. You can't have, because the kidneys, I got to tell you about the jobs of the kidneys first. All right. Before we go into that, the kidneys, most people think the kidneys is about the size. We just talked about the size of the fist, and it's located on your spine. You have two kidneys, right? The job of the kidney is to remove natural waste products from the extract from your body, from your water, help remove waste. It helps makes red blood cells. It balances important minerals in your body, like your calcium and your phosphorus. It helps maintain your blood pressure, and it keeps your bones healthy. So the kidneys are very important. So just say my kidneys, when your kidneys fail, I'm removing waste right now with my kidney that was donated, but my kidneys are not making red blood cells. So each month I have to come in and get a shot to help me make red blood cells, because quite naturally, if you don't have red blood cells, you get tired, you get weak, and you get exhausted. So a patient has to be compliant with his diet, his doctor, visiting the doctor. They have to go into the center. The next thing a patient has to do with being on the transplant list, you have to go to the transplant center and do whatever they tell you to do. That means you have to get a EKG, a stress test, an echocardiogram where they look at your heart from the inside, a resting echocardiogram. You have to do males have to do their yearly test. Females have to do a yearly pap smear, and I was at Shea, Tampa General, and Miami. So in order to stay on those transplant lists, you have to do those tests every year. EKG, stress test, heart test, the mammogram, the other female, the gynecological test, the males have to do that. So, and then you cannot have any test of signs of cancer. You have to see your dermatology. So all of those people you have to see before you get placed on the transplant list.
Okay, obviously there's a lot to do there, and there's a reason for all of that. And we certainly appreciate you sharing that. Do either of you have a question at this point?
No, I don't. The only one I didn't know about was the one with the sugar. the type of dialysis?
Peritoneal dialysis.
The peritoneal, but with the sugar
Yes.
aspect of it. I've had patients on that, you know, the home dialysis peritoneal and other variations, but never that. And that makes, it's kind of crazy to have you on it with that high sugar content.
Well, whatever it does, you know, most people think your heart is here, your kidneys are here and all, but it's sitting in a peritoneal cavity. It's sitting in a sac. All of your organs are not just floating around in the body. I mean, God designed the body in a wonderful way. So it's in a peritoneal cavity. All your bodies, your organs are in a sac, which is the peritoneal cavity. So everything that the fluid, what it does, some smart person decide, hey, if I can clean the fluid in the peritoneal cavity, bring it in, have it come out and extract it out, then that's the way they do peritoneal dialysis. You pump clean fluid in, you pump dirty fluid out, and then you clean your peritoneal cavity. Because all of your organs are moving and in this kidney, in this solution, and in this solution is cleaning your body, and that's what's causing it. But for my body type, my body was like, oh, we want this sugar. And it was just, I mean, I gained weight. Every treatment seemed like every time I woke up, I felt heavier.
So you were grabbing the sugar.
Yeah, I was grabbing the sugar. Some people it doesn't bother, but for me, I gained weight.
Okay, so you were an outlier.
Yes.
Yeah.
Okay.
How often you have to go through this kind of peritoneal treatment? Once a week? Or?
Every night.
Oh,
Every what?
Every night.
Whoa.
The same way.
Every night.
Think about this. You go to the bathroom how many times a day with perfect kidneys?
Maybe 2 or 3 times.
2 or 3 times. Okay. A younger person, let's deal with somebody in their 20s, 21. They go to the bathroom maybe 4 or 5 times a day. So you figure if you're eating, you have to get rid of the waste, and you're drinking, you're playing sports. Oh, please don't drink those Monster drinks. That's just an advertisement. Those drinks are very high and they're very harmful on your kidneys. When you drink those energy drinks, they give you that energy, but you also got to break that down. So you figure if you're doing those treatments, if you're cleaning your body requires you to go to the bathroom that many times, you have to do the peritoneal cavity every night, or at least maybe 4 or 5 nights out of the week. You may get 2 nights off. I do dialysis 4 nights a week, 4 days, 4 nights. I do it at home in the evening time.
You know, mention your energy drinks here, because I see a lot of young kids now just drinking energy drinks now. You know, that's the thing with them now. They just, at my center, I'm seeing 13 and 14-year-old kids on energy drinks.
Yes.
Go back.
Well, energy drinks, it's not that they're bad.
Okay.
It's the things that you're elevating, you're energizing everything in your body to work and go faster. So your kidney is in pumping and working, trying to keep up with all of that. And then it's trying to filter out all of those, whatever chemicals that's in there. And that's the problem. We was just talking about eating once a day. What you put in your mouth, what you're eating, I think that is the major cause of kidney disease.
Yes.
Mr. Cato, I remember you was my teacher. You still look the same. You haven't changed from. I mean, but I'm just saying, you think about your diet that you didn't eat a lot of processed foods when you was growing up. You probably still don't.
No, I still.
Now you think about if a meal today, if a child is eating, let's say if they having SpaghettiOs, okay, they may have crackers, or dessert may be a honey bun. Okay. The meat may be a hot dog. Okay. And no vegetables. Right? No vegetables or no fruits. So you consider all of that is processed, man-made food. Everything in there, the SpaghettiOs, the hot dogs, the honey bun, there's just nothing natural.
Chemicals. So
it's chemicals. So your body is trying to break down, and we have more people on dialysis now. Let me give you these tests.
Sure.
1 in 3 adults in the U.S. is at risk of kidney disease. Which is 1, 2, 3, 4, 5 of us in here now. I am that one person out of you 3. Okay, you see that? 1 in 3. 90 million people are on kidney wait list. They're on the kidney transplant wait list.
Not
Wait
in
list.
million.
90K,
90,000.
90,000, 90,000. And 12 die every day while waiting. All right. 1 in 7 US adults has kidney disease, and 90% do not
Yeah.
even know it. 90% out of that 1 out of 7.
So,
Because it's a silent killer. I mean, high blood pressure, you don't have any symptoms, you don't have any warnings, you don't have, it's not like if you have a headache, your head is going to hurt, or or your feet is going to hurt if something is wrong with your foot or your hand. You don't have any symptoms with kidney disease.
I want to add another statistic, and I hope I'm correct, where it says that the African American population is about 13% of those with chronic kidney disease, 13%. But there are 34% that are on dialysis, meaning of all the people on dialysis, 34% are African Americans, when in effect, only 13% African Americans have the kidney disease, something to that effect.
Right.
And I may be off a little, but the numbers are not good.
No,
They're
the numbers are not good. And I'm nationally, and this is from the National Kidney Foundation, African Americans make up more than 35% of dialysis patients.
Okay.
That's what you was, despite compromising compare 13% of the US population. So that's what you was talking
Yeah,
about.
that's what I was speaking
Mhm.
to.
They are also 3 to 4 times more likely to develop end-stage renal kidney disease compared to whites. So why is that?
Well,
I was going to ask you, I'm glad Ray brought that out, because when he told me that you were going to be on the show, I kind of did some research, and look at what it says. It said dark-skinned people have shorter lifespans. Why is that?
What do we eat?
Yeah, that's what
yeah,
I'm back
it's,
to.
it's food. It's
It's the food.
yeah,
Yeah.
it's
And that's
But you got to
Yes.
think about when we first ate pig feet,
I'm going to come to that.
when we first
Yeah,
ate,
I'm
we
gonna
ate
come-
pork.
Exactly.
It was a natural animal eating
Exactly.
natural
Natural
food.
Yes.
Okay, that was in your
Yeah,
generation.
I'm going to come to that.
Okay, so the pigs, the pork, the pigs, the cows, and all of that, they were eating naturally.
Gotcha.
Somebody said, if I can get more pigs, I can make more money.
mm,
So if I feed them some corn that's been generated,
Gotcha.
or food that's been generated, and they're eating it,
right.
and then they popping out pigs, and then we go in the grocery store and you got pork chops, you got ribs, you got, not saying that that's bad.
No, I understand.
You understand what I'm saying? But if you're eating pork 5 times a week, you eating steak 1 time, well, let's say chicken. You got to throw chicken in there because we love our chicken.
Right.
So if you're eating all of those and not getting any natural grown food, and then how are they making the food, even with the natural, with the fruits and the vegetables? What are they using? The chemicals.
Other chemicals, yeah.
And it's when I asked the question, how are people selected for the registry? You did a great job in offering an answer. But what I did not hear is a description of the different stages of
Chronic
Yeah,
CKD.
I
I'm gonna
didn't
give
hear
those to you
stage
now.
1, 2, 3, 4, and
Right.
5. And I was thinking you might have said, well, they have to be stage 5 before they can get on the registry.
No,
Or
they
that's
don't.
what I was.
Okay, let me
okay.
get. It was a young teacher, and I'm glad you brought that up. It was a young teacher at a school, and she was like, a friend of mine was referring her to our kidney support group, and all kidney patient support group, and she was like, "Oh, I don't really need to talk to you, Miss Janis, because I'm at stage 3, and and I'm like, baby, it's only 3, 4, 5. You're at 3. You're not. It's not 10. you know, most people think when you say stage 3 or stage 4, you're at end stage, you're going into end stage renal disease. So you're almost at the end. There is no, she was thinking that she had
And
7 more stages to go. But no, it's only 3 more to go, and she's at chronic kidney
Yeah,
disease.
you're in the midst of it.
Right. So let me tell you what the stages are. Stage number 1, that's your 90% or above. That's when what we got to talk about the EGFR. That's those terms that the doctors use. And let me explain what that is right now. That is the EGFR is your, right here. I got it right here. Estimated glomerular filtration rate. How you say that, brothers? Glomerular
Glomerular
filtration rate is an estimate of how well your kidneys are removing waste products from your blood. It is calculated using a serum creatinine level, age, and sex. It can be calculated using another level, but we don't use the citation C level. A normal EGFR varies according to age. It decreases as you get older. For this test, a higher number is better. In general, an EGFR value lower than 60 is a sign that the kidneys may not be working properly.
Okay.
So it's a stage 60. If you're having 60, so when you go to your doctor, you got to know your numbers. You have to get your lab. When you go to your primary care doctor, when you go to your monthly lab, when they do your lab in that little tube and that little blood, you need to ask your doctor, what is my EGFR? So if you're at 90% above, you're good. That's stage 1. If you're between 60 and 89%, you're at stage 2, kidney damage with mild loss of kidney functions. If you're at stage 3, mild to moderate loss of kidney functions, that's 45 to 59. Moderate to severe loss, that's 30 to 44. That's a 3B. They don't broke it down to 3B.
Yeah.
Stage 4, severe loss of kidney functions. It's between 15 to 29. That's the EGFR. Stage 5 is chronic kidney disease, which is where I was.
well, excuse me, but 3, 4, 5, even 2 are chronic kidney disease.
Yes.
But when you get to stage 5, you're at
End stage
Okay.
renal disease.
End stage.
You're at,
That's where you better get a kidney or you will be on dialysis.
you're going to be on dialysis. And we have so many people who are trying, and you can do this with your diet change. I've seen people reverse their kidney disease by becoming a vegetarian and limiting their meat, because you got to look at the process in the meat that we're eating now, which we go back to what we're eating, is causing our kidneys to overwork, and it's causing those filters in the kidneys to burn out. They call it scarring or infiltration.
Yeah. I'm going to question one thing. You said we can reverse it, but this is my understanding, and I'm going to say that with a qualification. You can't reverse it, but you can stop the progression.
Exactly. You could, but let's say their term. Slow it down.
Slow it down, or even
Stop the progression. And that's the
said.
terminology that they use.
Okay. I know we're near the end, and I wanted to give you time to talk about your organization.
Yes.
And we are out of time. We can always bring you back, but I'll just say your name, the organization name one more.
All Kidney Patient Support Group. We are having a gala coming up October the 4th. It's going to be at the Sky Beach Resort. It's going to be a masquerade ball, an evening of fun and elegance where you can really relax and have a little kidney education.
Excellent. Well, with all of that being said, I want to thank my co-host for another job well done. As always, I want to thank you, the listening audience, for tuning into the Ray Tampa podcast, and ask that you continue doing so on 99.1 FM the bird. And we want to say to Janis Starling, great job.
Thank
And
you.
we knew you would have a wealth of knowledge.
Yes.
And you have so much more that you didn't get to.
Right. We got to get into transplantation.
Oh, boy,
Yes,
there's
yes.
a lot
So,
there.
we need a part.
So at this time, we're going to say to each and every one of you, thank you for tuning in. And go to YouTube, type in the Ray Tampa Podcast, and you can see them all. Good evening.
Goodbye. Didn't even get the most of this.